From Eyewitness News, this is Newsmakers.
Welcome to Newsmakers. I'm Ted Nesi, filling in for Tim White, who's getting a much-deserved vacation here at the tropical island he owns in the Bahamas. No, just kidding. All right, later on in the show, I'll be joined by the editors of three of Rhode Island's top regional newspapers to talk about the big headlines in their neck of the woods, perhaps your neck of the woods too, so that'll be something to look forward to. But first, very glad to be joined by, returning to the show, Rhode Island Health and Human Services Secretary Elizabeth Roberts. Secretary, thanks for being here.
Good morning, Ted.
So we're going to start with a topic I've been covering for a while, arcane to a lot of folks, a lot of taxpayer money at stake. You know which one it is. UHIP. This is the big computer project the state's undertaken to upgrade all the systems for social services. Cost is $364 million, about 4/5 from the feds. Its launch was recently delayed another 2 months from July to September. So I received an unusual whistleblower letter the other day, unsigned, claiming to be from staff at the Department of Human Services. I get a lot of these, but this one did ring true, I have to tell you. And they said UHIP, quote, remains riddled with bugs and is still unable to consistently deliver accurate results for several important functions, most of which, we're sorry to report, 60 days is not going to fix. Is that right?
Actually, I don't believe that's right.
Okay.
And we are working closely not only with the employees, but also with our federal partners. And believe me, they are taskmasters. As you said, they're paying 4/5 of the bill. They want to know that this project is going well. We're actually, part of our extension in time to September is to do more pilot testing. We've been doing user acceptance testing, which is what that employee is talking about, and had a significant improvement over the last 2 to 3 weeks as we have worked through those bugs. They're correct. This is a huge IT project. When you think of the hundreds of thousands of people we serve through these programs that we're talking about, food stamp benefits, health insurance, Medicaid, so private and public health insurance, child care support, TANF benefits, welfare benefits, all of these are being run through a single integrated system. It's going to be a huge step forward, better service for the people we serve, better value for the taxpayer.
But it was supposed to be a huge step forward, I think, last year when it was supposed to launch. I mean, it's been delayed again. Is there any, will it make the September launch date?
It's going to make the September launch date. And let me also, I'm going to correct you a little. You could say it was delayed. We actually chose to move it so that we could improve the system. We changed that system during the year. It wasn't that we said, wow, we can't get this built the way we wanted in the time. We had an opportunity, and the federal government agreed to support it financially, to create a single system rather than two separate systems, one for health insurance, one for the rest of human services. That's what most states do, and you end up with a lot of difficulties where people's names don't match. You end up with more problems and more inefficiency. The federal government said, we're going to throw some more money into the pot so you can make a better system. And we said, yes, we want to do that.
The former Health Source Director, Christine Ferguson, said during the transition from Chafee to Raimondo, she said there were serious technical issues with this. And it was a real problem for Health Source because it wasn't the computer systems weren't doing what they were supposed to.
Well, and it was 18 months ago, and we've been doing an enormous amount of work. I also want to comment, so Health Source Rhode Island, one of the only health insurance exchanges in the country that went live and has never gone down. We have been functional. If you remember, the federal system didn't work. Many states, including our neighbor to the north, did not work. Rhode Island's has worked. Of course it's complicated. I like to hold up my iPhone and say to people, how many people have upgraded their operating system on their iPhone, and how perfectly has that gone? There often are bugs and glitches as you do big IT builds. We've experienced some. That's why we're working so hard to make sure it launches well. It will be complicated as it launches, but we want to serve people better. We want to serve the taxpayer better. You know, this system we're running, I think you were probably in diapers when we launched this system, and it's a big change.
This is what it's replacing.
Correct. The old system, excuse me. Yeah, the old system launched in the 80s back when Reagan was president. So think about the leap forward we're taking all at once. Most corporations actually build over time. Government, unfortunately, frequently does the big change, and big changes are tough, but we are working very hard to get it right.
So when you push the button in September, do you think it'll work smoothly? Do you think people should be ready? Are there going to be a lot of delays or problems as it gets up and running?
So it's going to work. It will never be perfect when it goes live on September 13th. And we've got teams in place. You know, we've got all kinds of contingency plans. We've got all the appropriate things you do to make sure when everything doesn't go perfectly, the people get served. And but one of the reasons we're doing the extra testing over the next few weeks, or actually 6 weeks, is to make sure that just what that employee talked about, end to end. Person walks in the door, starts the process, person walks out the door, or person gets on at home, Think about the difference this is going to make. You can go online at a CAP agency, in your home, at a public library, or you can go into a local office and get personal assistance.
All right, I want to
change.
turn to the opioid overdose crisis. Governor Raimondo said the scale of it really shocked her when she took office, and you've been at the forefront of working on that. She wants to see the number of overdose deaths down by a third by 2018. Right now we're halfway through 2016. What's the trend? Is it getting worse? Is it getting better? Is it not really changing, just continuing at the same pace?
So actually, I don't have the most up-to-date numbers, but I'd say we're about where we were. One of the biggest challenges we have right now is that fentanyl has become a huge reason for overdoses, not what was expected probably a year ago. So that presents all new challenges. This week in the paper, we saw, for example, we've been pushing the physician community to prescribe differently because we were seeing that too many opioid prescriptions, the problem of benzodiazepines and opioids together. Dr. Alexander Scott has really been a national leader on this issue. We're making real progress. The number of opioid prescriptions are down. We're seeing fentanyl overdoses up. So it's a huge challenge, but we're investing significantly, both with our prison population, which is where we see a lot of our addicts end up in our criminal justice system, also through Medicaid to help people as they come into emergency rooms. I want to think about some of the families. We've had some amazing families step forward to tell the stories, tragic stories. And there's one in particular, Deborah from Cranston, who has spoken about her son who died at work, actually, of an overdose. There was no reversal drug there for him, and we're trying to make sure that that drug is available everywhere. So many things we're doing. I really salute the legislature because a lot of substantive bills passed, and the governor will be signing them this week, and also significant resources because we need to make sure we have the staffing for services and the medications for people to be treated. It's a disease.
Let's talk Medicaid, the state federal health insurance program, third of the state budget. One of the big initiatives your office has undertaken as you try to slim down the cost of the program is new incentive payment programs for hospitals and nursing homes. I remember when I was covering the budget, you were still waiting for federal permission. We were hoping to get that last month. Have you heard from the feds? Are they going to approve that?
We're in frequent dialogue with the feds. We expect them to approve it. It is in its review process right now in a 30-day review. I think it will be late summer. We've been in regular communication with the hospital community. They know what's going on with it. But we're very optimistic and expect a multi-year approach where we're really investing in changing the system.
You mentioned the hospitals. We just went through Memorial Hospital closing down parts of what they do there. A lot of outcry about that. Their parent, Care New England, trying to merge with South Coast Health of New Bedford. You've been working on these issues for decades now in Rhode Island about how we change the health system. Are you concerned about the stability, particularly Care New England, but of the health of the hospital network in Rhode Island, their finances, the way their ability to serve patients?
So across the country, use of hospital inpatient beds has declined significantly. So this isn't a unique situation. If you've been, I've got a friend who lives in Greenwich Village in New York, huge hospital there, closed a few years ago, St. Vincent's Hospital. We use, when I was born, my mother was in the hospital for more than a week. Now when you have a baby, you're in the hospital for a day. We don't use hospitals the same way. They're still very important parts of our healthcare system. So you see an organization like Care New England creating an accountable care organization where they're joining with primary care and really trying to build health in the community rather than just focusing on caring for sick people who need inpatient bed days. So what you see at Pawtucket is they're maintaining a place. I started my career, actually, the family care program. They're maintaining their outpatient services, their emergency department, and some limited inpatient services. But we do not need as many inpatient services as we needed a decade or certainly 2 or 3 decades ago. And you're seeing that throughout the country. It's actually good to see a hospital system stepping forward and saying, we want to change and we need to change.
Do we need fewer hospital beds in Rhode Island?
We do, and that's what you just saw happen is some hospital beds were taken out of service. We don't, if you look at inpatient rates at many hospitals, it's down below 50% in some. So, in terms of rates, occupancy. So we don't need them, but we do need high-quality health services. Hospitals are part of that.
I'm curious, I mentioned your long career in health policy advocacy, and you were always seen as an advocate for more Medicaid spending. Let's do more. Let's have the state government take a bigger role. Let's add programs. And now you're tasked with slimming things down, saying no to people, saying we need to spend less on that. Has that been a hard transition for you to be on the other side of these, to go from advocate to the one making those tough decisions?
Actually, I still see myself as an advocate. What I'm advocating for is more effectively coordinated care. services. If we actually are using inpatient beds and hospital emergency rooms more than we need to, that's not good for the people I'm advocating for, and it's very expensive. So I'm excited to see us coordinating using our community mental health organizations and our primary care, whether it's in Coastal Medical or in Thunder Mist, where they're really becoming the home base for our care. That's what I want to see. It's less expensive and it's better quality care.
You've been in this job since Governor Raimondo started. Could you see yourself staying in it for a while longer? How you feeling about it? It's a lot of work.
It's a lot of work. I love it, I have to say. And I'm excited to work for this governor. She is someone who believes in the role of government and believes in change. And it's amazing to me. Here we are a state, as you said, we're a big Medicaid state. We're actually spending less per enrollee on Medicaid. And we're overall, despite increasing enrollment, level spending. So that means there's more to spend on education, on job creation, and we're still meeting people's needs.
All right, Health and Human Services Secretary Elizabeth Roberts, thank you for joining me.
Thank you.
Don't go away, though, because coming up next, we're going to have a roundtable of the editors and publishers of some of the top regional papers in New England about the big local stories happening right now. Stick with us on Newsmakers. Welcome back to Newsmakers. I'm Ted Nesi, filling in for Tim White. I got my start in newspapers, and I have a great love for them, so I'm being joined by three of Rhode Island's great ink-stained scribes around the table here with me. John Howell, he's the editor and publisher of the Beacon Communications papers based out of Warwick. Tom Ward, he is the publisher of the Valley Breeze in Northern Rhode Island, and Liz Boardman, editor of the Independent South County, which is no longer the South County Independent, right?
Right, it's the Independent.
It's the Independent. We've changed the name, so don't call it the South County Independent anymore. Drives their newsroom crazy. Thanks all of you for joining me. This will be fun. So it's an election year. We just last month we had the filing deadlines for candidates. We were all watching to see who'd get in which race and everything else. And I'm curious about what's going on in your neck of the woods that you all track closely. John, I'm going to start with you. So it looks like a pretty big campaign here in Warwick, right?
I don't think we've ever seen anything quite like it. We've got 20 positions, 58 candidates declared their intentions to run for those, those various council seats and state seats. Some of them in one district alone, in District 21, where Representative Eileen Norton is running for re-election. There are 7 candidates. There's a 3-way primary, and there are 3 independents.
That's a big race.
I've never seen so many independents across the board. And the mayor, on the other hand, has got an opponent, a Democrat.
It's Mayor Avedisian.
Right. Set up there. You're not seeing it at the top of the ticket, at least in Warwick, but right down through.
What are you hearing anything as you start to talk to these candidates bubbling up? Is there a thing driving so many people into politics this year?
I think the national political scene has obviously stimulated the whole process. There are some people that say, well, if Bernie can do it, I think I can do it. Mm-hmm. You've got that, and you're seeing something else. I think, at least in the case of Warwick, which is interesting. There's a candidate in District 21 who's currently a member of the City Council. And she's very much in favor of term limits. So she's leaving the council. She's served 3 terms there. She's going after the state office. And as you know, Doreen Costa has done that on the state level. I think you're seeing a bit of, they've been in long enough. Mm-hmm. I will serve. I'll do so many terms. I'll have my shot at it, and then let somebody else do it.
Well, that's a good segue, Doreen Costa, in your neck of the woods in South County. Liz Boardman, a lot of us, I was surprised. I didn't expect her to step aside. I don't know if you guys all knew it was bubbling up.
We were surprised, too. She had been tweeting as late as the week before and was still raising money, had a fundraiser June 9th for the House seat, so we were as surprised as everyone else.
I've seen some interesting races over the years for Assembly in the South County. Teresa Tansey often gets a good fight down there.
She does this year,
Spencer
too.
Dickinson always keeps things interesting. He's back. So what are you watching, though, this year?
We are definitely looking at the Tansey, Rachel Clow, who has been was a one-term South Kingstown town councilor, who is pretty aggressive, a little bit more of a conservative Democrat than Teresa. There's also a third person in that race. She is Iwa Deserinsky, I think. She has done some advocating for pharmaceutical in the State House. Otherwise, unknown to us. So that's an interesting race. It's also interesting to see Spencer back for the House 35 against Kathy Fogarty, who's been a terrific, 10 years on the South Kingstown Town Council. Very knowledgeable, very matter of fact. So that's going to be an interesting race. She's beat him in a primary, he's beat her in a primary, so it's another matchup. And then they will have an independent in November.
Are you seeing Jean-Claude's been impressed or intrigued by the level of competition he sees in his, how about in South County?
South County, same thing, 12 to 14 people in our council races, which, sometimes we'll get that, but not, we are seeing definitely an uptick. And it's interesting that a lot of them are issues driven. There were a few Bernie supporters who wanted to, were inspired to jump in, but we're seeing a lot of, they were out advocating for a particular, Save the Larchwood Inn, or they don't like the Wickford Elementary School redevelopment plan in North Kingstown, and that has driven them to come in and say, we want to try to make a change.
All right, Tom Ward, let's move north to Valley Breeze territory. So what are you seeing up there?
Well, we have a lot of races. I hope you forgive my having to write notes, and so we have
That's all right, I got a lot of notes here.
5 newspapers, and I'm not the reporter. Certainly North Providence, the mayor's race is going to be very heated.
That pits incumbent against Kristen
Charlie Lombardi, who's been there for a while, Kristen Catanzaro, former town council president.
I feel like that's already been going on for months.
It has, and it's been going on forever, it seems, to people like Ethan Shorey, my reporter. He's been dealing with this for a long time. But also, even though they're going to fight it out in a Democratic primary, there's a gentleman named Brian Quirk, who's a frequent letter writer, and I must say, a very good writer, who's very anti-Charlie Lombardi, so he's waiting in the wings for the November election as an independent. We notice the same thing as you guys, so many independents, to the point where I start to, I don't know, say worry, but I think we're going to wind up with much the same when it's all over, because we see so many House and Senate races where there's the incumbent who might have to finally face some competition, and who are they facing but 2 independents. So that's going to wind up splitting the anti-vote, and you know how that's going to wind up. Or at least
you often see that where once you get a multi-tier race, actually helps the incumbent.
So you'd think the independents maybe in the next week would go somewhere and buck up, and one of them's going to get out.
People need to remember they have to put their signatures in. We could still see fewer people in the end on the ballot.
Right. And so, there's a ways to go. North Smithfield, a very interesting race. North Smithfield bringing Gary Azovsky, who served the town in many ways in the past, came out 2 years ago. North Smithfield had no interest in the town council, and some people came in who really wanted to shake things up. And they've rubbed some people the wrong way. One of them is Robert Paul Boucher, who was council president. He is now running for administrator. But as we've seen across the state, a lot of people running for council. I think, frankly, there's some disquiet and some unhappiness with the way Paulette Hamilton, who was the town administrator, might have been handled, and so it's going to be interesting. But Gary is kind of a steadying guy, and a business executive, and it'll be interesting to see how that plays out. Which side of that wins. There's also another newcomer, Michael Amalfitano. No one's heard of him, and you're seeing a lot of these people too. People that we haven't reached out, and they haven't reached out to us yet. They're busy getting their signatures.
Right.
We'll be talking to them. In Woonsocket, Lisa Baldelli Hunt looks certainly safe. Roger Gillette, long-term counselor, against her, but that's going to be an uphill battle for Roger. But again, 19 candidates for 7 city council seats. So huge. Cumberland, Bill Murray, as you know, Mayor Bill Murray.
I'm interested in that. Bill Murray, the only mayor I saw all over the state who is unopposed, even though first-term Democrat. You'd think maybe first term you go after somebody, but he didn't draw a challenger.
Yeah, no, my explanation on first terms, I told this to Mayor Murray many times. I said, I think you're going to get a pass. I tend to think voters tend to be a little bit more fair with 2-year terms. They kind of take a wait and see, and I think it's tough to knock off somebody after 1 2-year term. I think they have to have really kind of messed up to get knocked off after 2 years. The other thing was people expected Art Lambie, who was a Republican counselor and always had a lot to say and was an accountant, very well versed. They thought that perhaps he was going to step up and run for mayor. Instead, he stepped aside entirely, and he's helping B.J. Charette, who's a Republican candidate against Ryan Pearson, Democrat Ryan Pearson, for that Senate seat in Cumberland. So he stepped aside, and that kind of let the air out of the balloon, but also lots of candidates. Another one is Ed O'Neill's seat. We all know Ed O'Neill.
Right, that's a big fight up there for the independent seat.
He also term limited himself, 8 years, and he said, I'm done. He came to fame by beating Joe Montalbano 8 years ago, the Senate president. But for that seat right now, we've got 5 Democrats and 1 Republican. There's going to be a big squabble on the Democratic side, and of course one colorful Democrat, Kevin McKenna, who a lot of people know. And Kevin's going to be one of those Democrats in that scrum. In Pawtucket, Don Grebian, probably safe, but it'll be an uphill battle for challengers, but they are challengers. They're real challengers. John Arcaro, who's a colorful guy, he named his party, which we found out is legal. He calls his party the Sick of Scandals Party. And then Kevin...
I saw that come out. That was a typo, but that's his party.
No, and we found out that he can really name his party that. And Kevin Crawley, who's a retired now police officer and attorney, is also going to be running. And then, of course, Jamie Doyle. That'll be interesting to see what happens with Senator Jamie Doyle's seat.
Almost not fair to Tom. You have so many talents.
I know.
Valley Breeze, you guys
get the rest of the show.
Yeah, exactly. John Howell, I want to get off politics. I want to ask you, just got the press release in my box this week on the airport expansion at TF Green, and a perennial story. Talk about something that's filled a lot of papers for you over the years.
Oh, over the years.
How controversial at this point? You know, it's moving ahead clearly. Strong support from Jack Reed, among others. How controversial is the airport expansion at this point in Warwick?
I really feel the issue is over. It really played out a couple of years ago. And at that point, they signed a MOU, Memorandum of Understanding, in terms of what, relocation of the fields, the Winslow fields, the decision to go ahead and extend the runway to 8,700 feet. And so what we're seeing now is really that whole process is fulfilling itself. And the new runway extension is going to open by the end of 2017. In fact, they've got the date, December 6th.
They know exactly when, right? And you'll hold them to it.
Yes, of course. So I don't think you're going to see that sort of outcry because there are no public hearings. This is the process that's happening. But on the other hand, what you're seeing at the airport is not the growth that they had really anticipated with all of these developments, even because airlines are working far ahead. They would start planning, maybe doing routes and stuff like this. And I think the industry as a whole is taking a look at the whole issue of capacity. And they're trying to pack those planes as full as they can. And one figure I heard when Azores Airlines opened up, I said, where is it profitable? And they said at 90% capacity. So they're not going to add a lot of flights until they fill up the planes that they've got right here. And as you already know, they're using smaller planes because they can't fill up the larger ones. So this thought that we'll build it and they'll come, I don't think
We're
it's
not
going
sure
to
if they're
happen.
going to come. The state actually put some money in the budget now to try to subsidize some flights. We'll see if that takes off. No pun intended. Liz Boardman, we're talking about property there, really, when we talk about the airport expansion and development and all. Historic preservation sounds dry to people, but drawing a lot of folks to meetings in South County.
All sorts. That in all 3 towns, there are issues of either redevelopment of historic properties, the town hall in North Kingstown, which the council, Republican-dominated council, has decided to vacate because it has a huge list of health and safety code violations. The old Larchwood Inn, which many people remember in South County, that's been empty since 2005. And there is a plan to tear it down, which has upset a lot of people. And you'll get into meetings and there'll be 80 people there, which I think is not typically when people say a comp plan, your eyes kind of glaze over, but that it really matters to people how we're going to maintain not only quality of life, but sort of that sense of this is a unique place. And not to say anything horrible about Warwick, John, but everybody always says we don't want it to look like Route 2, and
Hill Road,
and that does bring in so many people to we want to keep Wickford a quaint, old-fashioned, historically a large number of historical buildings. They want to keep that, but now sewers are going in, and how do they balance that with what development could be coming once the sewers are there. And so it's been very interesting. In Narragansett, the students are really the quality of life they're trying to maintain, that has become the place for the University of Rhode Island students to live. Some neighborhoods that were built as family neighborhoods in the 80s and 90s are now 99% rentals. And that those handful of people who are left, feel like they're lost, and that they're kind of in the middle of a frat zone, and how is the town going to deal with that?
Yeah, a little different from what you expected when you go.
Definitely.
Tom Ward, 30 seconds left, but one that caught my eye that you mentioned when we were talking in advance: gypsy moths. Huge issue up there, huh?
Well, huge everywhere, I think, mostly because they just hatched this weekend.
Yeah.
And we were up in Echo Lake for a party up in Burrville, and I couldn't believe it. I mean, it was just a swarm, and I have a convertible, and we're pulling up, and I'm like, holy mackerel! I felt like I was in The Birds, Hitchcock's The Birds.
Sorry though, Tom, no sympathy for a guy with a convertible.
No.
And that's the lucrative world of newspapers. No, thank you so much, Liz Boardman, Tom Ward, John Howell, for joining me. This was so much fun. We're going to have to do it again. Don't forget, pick up your local paper, because that's how you find out what's going on in your community, and they do some great work at all of these. Tim White will be back next week. See you then on Newsmakers.